This is the second preparation session for the module SA4M8E Economic Evaluation, which will run in the second teaching week of June. In this preparation session, we'll be talking about the two main types of model that can be used to build an economic evaluation. So these are decision trees and Markov models. So before we do that, I just want to think briefly about how you would define the problem and choose a model that you would use for your economic evaluation. So the steps in doing this would be a specification of the research question. So that would involve selecting the relevant health area, selecting the patient group that you wanted to be included in your economic evaluation, and selecting the relevant interventions that would form the two or more alternative courses of action to analyse. So in many cases, the relevant intervention will be a gold standard versus a new intervention. But if an intervention was novel enough, then this could be the baseline or usual disease progress that would be used as a comparison. Similarly, you could use more than one intervention to compare to a baseline or to the gold standard, and this would help you gain an understanding of the various courses of action that are available in terms of their costs and consequences. And once you've made some of these decisions, you need to decide whether to use a decision tree or Markov model in your analysis. And there are different merits of each of these models, and they could be applicable to different research questions in different ways. So we're going to talk briefly about these two now. There are other models that can be used for economic evaluation, and you may see these in the published literature. So these would include microsimulation, and that's something that's much more complex and requires a greater understanding of specialist software, and so is something that we won't be covering in this module. So I'm going to show you an example of a decision tree in a second, but first of all, what are they? Well, they contain a series of discrete pathways that can be followed through to an end. And people who are in a cohort will move through the pathways according to set probabilities. There will be costs and outcomes assigned to each of the pathways, and from this you can determine an expected cost or expected outcome for each of the alternatives that's available. So as you'll see from the decision tree I'll show in the next slide, these can be very good for one-off decisions where there are shorter term impacts, perhaps for acute care or a surgical decision that is taken once and then leads to set pathways. So I've chosen this example of a decision tree, and it really represents the most simplistic conceptualization that you could use. This was a study that looked at TAVI versus surgical aortic valve replacement. And you can see that the pathways that people could follow were TAVI, followed by a series of New York Heart Association functional classifications, or they could proceed to a state of being dead. Alternatively, the traditional surgical aortic valve replacement could have been used, and again, there are these functional classifications that people will move into. If you are working with this decision tree, you could assign a set of probabilities for the likelihood of people moving from either intervention into the series of functional classifications or to death. And you could assign a cost to each of the pathways. So that would include both the cost of the interventions in the first stage and then the cost associated with the different health statuses after the intervention was used. So as I said, this really is a very basic decision tree, and many of the other trees that you'll see in the literature would have a series of other pathways that can be followed after these initial steps. So this demonstrates where a decision tree as opposed to a Markov model might be useful. It's looking at the short-term outcomes after a clear surgical decision, and I presume that the authors decided there wasn't a great scope for movement between the states. If you use states where there could be a great deal of movement, then these pathways would become very, very complex, and you'd end up with multiple branches that would move out into the future. So Markov models are much better when you're looking at longer time periods where there can be movement between different health states. So they contain a set of discrete health states, and transition can be made between the health states according to a set of probabilities. Costs and outcomes can be assigned to each of the states, and a series of cycles are run over time to calculate the costs and outcomes that are associated with how people move through the model. So as I said, and as you'll be able to see from the examples that I'll give in a minute, they're much better for longer time periods where there's more movement between states, and they can capture this more adequately. So this is an example with a fairly simple Markov model. You can see that these are the states that I mentioned previously that people can occupy, and they'd have a cost and outcome associated with them. The arrows indicate how people can move through the model. So as you can see here, people can stay in state 0, and the other arrows indicate how people can move between states. So in this section, the authors have included how people would move one state to the other. So they've classified these 3 as major events, and then people would move into the stable post-major event after experiencing these. When you are modeling when you are calculating the costs and outcomes associated with different interventions, you can imagine that you're running 2 sets of this model. So you'd have one cohort moving through this model with one intervention, and you'd have another cohort moving through this model in another intervention, and then you'd compare the costs and outcomes across these 2 interventions. So these authors have chosen to use health states as their Markov states, and the next example I'm going to show you is a different way of looking at this. So here we have a Markov model which looks at the cost effectiveness of transcatheter aortic valve replacement in patients ineligible for conventional aortic valve replacement. And this is very similar to the topic that I showed you for the decision tree, and the authors have used these different models to capture the costs and outcomes associated with the interventions. So there are legitimate choices between the models, and it's not that there's a set answer for the case that you're modeling. So this model differs from the one I showed previously in that instead of using a set of health states, so that is the major events that the model used previously, this is looking at the services that someone is receiving and where they're based in the health system. So people would begin in the intensive care unit following surgery, and then they could move into a series of states. So first non-intensive care, or they could die after receiving intensive care, or they could move to post-hospital rehab, to home, and again there are later movements that can happen between these groups. So as with previously, you could assign a set of costs and outcomes to each of these states, and with a series of transition probabilities that determine how people move through the model, you could record the overall costs and outcomes over a particular period of time. It's quite frequent for decision trees and Markov models to be combined as well. So in some cases you may want to use a decision tree to model the short-term effects of an intervention, and then to move a cohort into a Markov model to reflect what happens over a longer period of time. In this paper, actually I think 2 Markov models were used. So this is the short-term version, and then a simplified longer-term version was used to model what would happen over a longer period. So as I said at the start of the last recording, we definitely don't expect you to have a great understanding of these issues after this summary in this recorded session, but we hope this will give you some idea of the travel of the course and to help you think about economic evaluations before the course starts, and to give you some idea of the content that will be covered. So that's the end of this session, and in the next session I'll be looking at how you would identify and synthesize the different transition probabilities, costs and outcomes that would be involved in these models.